So I told you that dentists are very, very interested in what we're doing with cardiovascular inflammation. And it has to do with looking at half the mouths they look at on a daily basis have some bleeding, some gingivitis, which is very much related, both causally and otherwise, both cause and effect with cardiovascular inflammation. So don't be surprised to see a lot of dentists. If you do come to the Healthy Life Summit, there's actually a concurrent conference, as we've mentioned several times, called the Healthy Dentist Summit, because so many dentists come to it. Now, just be aware, if you're not interested in any of the dental components, you may just want to skip the video. And remember that we've got concurrent sessions that are outside of the dentists for any of the dental components. But if I were you, I wouldn't skip this video if you don't know anything about gum disease and cardiovascular inflammation and the association with heart attack and stroke. One of the things that this might do is the information that you see can arm you to help you help your dentists, help others, yourself and others. Most dentists see bleeding. They see so much of it, they just consider it a normal part of dental activity. And the reality is they should know. Most of them have heard it in the past, but most of them really haven't studied the connections between gingivitis and cardiovascular inflammation. So without going on too long, I'll hand you over to Doug. This is content. Doug, you've seen him on, Doug Thompson, you've seen him on other videos on this channel, and he's going to cover the dental component.
My name is Michael Harris. I'm a general dentist in Madison Heights, Michigan. I saw David years ago at a lecture in Chicago, and I've been looking at his videos on the web for actually a couple years. And as soon as I heard about this class about, my dad died of a heart attack, as soon as I heard about this class of, oh, you can maybe help with heart disease and strokes, I was very interested in it. And then at the end of the video it said, and if you're a dentist, you'll get 10 credits and it's tax deductible, but I was going to go even before I heard that. I think it's going to change my practice a little bit. I'm open to a lot of these ideas. I think because I took this class, I can give a little better level of care to my patients. More people in the United States die of heart disease than men and women than any disease in this country, and I think it's a good idea to take this course if you want to help prevent you or your patients, to make a less chance that that happens to you or your patients.
Next, I want to introduce you to another faculty member, Dr. Doug Thompson. As I said earlier, he's a dentist and the founder of the Wellness Dentistry Network. He'll be discussing the oral DNA test you'll personally be receiving at the summit and how important it is in the prevention and treatment of cardiovascular disease. Here's a sample of just a portion of his program, and at the end, he'll show you how this applies to a particular patient's case.
Let's look at gum disease. Gum disease, we have about 10% of the population. This is a bell curve of who has gum disease in the world. And about 10% of the people have almost no bone loss. They have no gum disease concerns. They might not show up at your practice for 20 years. And they walk in and their teeth are just fine. They have no disease. These are only about 10% of the population. 80% of the population, if they went 10 years or 5 years even without seeing a dentist, they would have some kind of issue in their mouth that would be a little bit of a problem. And then 10% or more of the people have very high risk. If they didn't see the dentist every couple months or every 3 months, they'd be in trouble. So this is the distribution of people. But what we were concerned about, and what I learned about at University of Michigan, and what I was most concerned about was gum loss, or tooth loss. Losing a tooth, that was the key. I didn't learn anything about inflammation and the effect on systemic health. Today, I'm just as concerned about this as I am about losing a tooth. And that's why some of your dentists, or some of the dentists, might not have started to talk to you about loose teeth or damaged teeth or inflammation around your teeth, because they sat down, they looked at you, and they said in their brain, I don't think they're going to lose a tooth. They're fine. We'll just have them come back later. But that's not what we're looking at. Now we're also looking at inflammation, and I want our care providers to let people know if they have excess oral inflammation, they need to know it. It would be beneficial. So this is the current model of gum disease expression. This is our current model, and this is how it happens. It starts with bacteria. David mentioned it in one of his studies, that gum disease starts with bacteria. It can be aggravated by this host immunoinflammatory response, because this is what creates the response to these bacteria that determines whether the disease stays confined to the gum tissue, and it's just red puffy gums called gingivitis, that's what we call that, or if it goes on and causes more destruction and breaks the bone down that actually holds the teeth in the head, and now we call it periodontitis. This is a much more severe disease. And so this model is a very good model, because I'm going to talk to our dentist friends about doing something very different in this box that we never used to do before. And it's going to be about measuring microbes to help us determine how this disease transpires. So I want to create some awareness about these total health. I want to talk about this new concept in periodontal disease management, which is looking at the microbes. And you all had this done. I believe you've all rinsed and sent your rinse sample to Oral DNA. Have they done that yet, David? That's been done? So that's what you were doing at that part. You were doing a bacteria test to determine which bacteria live in the mouth. Why? Because there's a relationship of those bacteria to vascular disease. And I want to bring that home for you and tell you about why that is. And obviously, if you are sitting in the audience as a dentist and you really don't have a detailed policy right now about how you handle gum disease, I hope we'll spur some ideas that might help you jot down some ideas for how you could do that a little bit better. And realize that this is a biofilm-induced disease. In other words, it's initiated by bacteria, but it's the way your body reacts to the bacteria that makes the big difference. What determines this reaction? This reaction is determined by genetics, that's your innate risk factors, and your environment. One of the biggest risk factors for periodontal disease would be if you smoked. That would be a bad deal. Now, obviously, we learned if you don't eat right, if you don't have the right vitamin D, if you don't have the right omega-3s, if you don't have some other things, you can also suffer. So there's a nutritional component, but it's all environmental. Sleep, stress, all that stuff is important in periodontal disease management. So I only want to show one paper about periodontal disease and the link to cardiovascular disease. What does the paper say? It says that a component of cardiovascular disease involves the innate and the adaptive immune systems. That's genetics and our environment. It's how you live based on what your genes show. Also, it's initiated by bacteria. This particular paper was a review paper of 152 other references, and it showed that 40 papers just looked at the role that biomarkers have, or that periodontal disease has on blood biomarkers. 16 papers looked at how it affects different blood characteristics, fibrinogen and clotting factors. 19 on antibodies, and 22 papers on how periodontal disease affects our lipids and the blood chemistry that you had measured through the Cleveland Heart Lab. And that's what the phlebotomist was doing today, taking that blood. So 97 papers in all talking about this. So if somebody says to you, if you share something with your local physician or cardiologist and they say, I just don't really believe there's a connection, just cite this hand them this paper, and it should really put all those issues to rest. It's a great review paper on how significant gum disease is. And so here's what happens. This microbial challenge, which is the bugs that live, this is the tooth, and this is the gum right around the tooth. And so this is the area where you get a popcorn kernel stuck, or you get something stuck around your gum that you would use floss to get out. And what we know is there's bugs that live in there. And so when you do the saliva swish and spit test, you're going to get back a report that personalizes the bacteria makeup or the load of the bugs that are living in and around your teeth. They don't just live on the teeth, they live in other areas of the mouth as well. But for the most part, we're taught and we've been trained they live on the teeth. And we get back very colorful reports, and there's at least 3 companies now. David selected the Oral DNA company. It's the easy company to work with, but there's several companies now that will provide these reports for us. And this is how it works. You have a patient that comes in with periodontal disease. They have high levels of bacteria. They have a lot of bleeding, and we have a special chart that we collect that I'll review in my next session to determine that. We treat them. We treat them to a healthy standpoint through a treatment methodology that I'm also going to share with you. They come back and we retest them. You'll see the bacteria profile is very different. The post-bacteria profile is very different than the pre-bacteria profile. This patient, I have patients that have maintained altered microbial profiles for now up to 9 years. They totally change the biofilm load in their mouth, and they keep it stable for years after the initial treatment. So and we can use these metrics to determine how the patients are doing, and it's really nice. What I've also learned from using these metrics is that it takes patients on average 4.5 months to alter the biofilm significantly to where it really relates to health. So in other words, the alteration of the biofilm in the mouth takes a while. You don't do it overnight by becoming a better brusher or by using just another kind of floss. It takes quite a bit of effort, and I'm going to go through that in the next hour. It takes quite a bit of effort to alter that biofilm and to keep it altered for a long period of time. It's much harder than I learned in school, and my testing using these metrics has allowed me to determine that. So it's really great. I also want to be clear, this item number 2, I want to be clear that if you have gum disease is not a disease of neglect. You don't get gum disease because you don't brush your teeth. You get gum disease because you have a reaction to bacteria that live around your teeth. Then if you don't brush your teeth, it's a big problem. But you don't get gum disease. We have people that don't brush their teeth and don't really get damaging gum disease. It's really it's in the autoimmune family of diseases, and it's not a disease of neglect. Additionally, we have patients that we determine they have disease, and when I used my old conventional treatment methodology that I learned in 1994 at University of Michigan, I would do pre and post-test reports, and you do not have to be a dentist to look at the colorful bars, and if I said to you, tell me the difference between those two graphs, you would say there's not much. Well, guess what? This was my old conventional treatment applied to a patient, and unless I used metrics to determine that, what my results were, I would have no idea that the patient's gum health looked a little better, their pocket depth looked a little better, but I did nothing to alter the microbial load. And if you don't do something to alter the microbial load, that disease will come back with a vengeance, and it'll be back in a year. You'll have the same thing all over again. And we see this time after time in practice. We have to alter the microbial load to make a difference. This patient is missing some teeth down here by the x-ray. This patient's going to have implants. Implants, as we know, down in the villages are doing a lot of implants on patients. People are making these kinds of choices. It's a great way to replace missing teeth. And when you're going to have implants put in here, thousands of dollars of implants, it would be nice to know what does the bacteria level have to do with the success of implants. And I can tell you this is a pre-implant study and this is a post-implant study and a post-disinfection study. And I would tell you that the patient with reduced microbes is going to have a better chance of having those implants succeed than putting those implants in a mouth that has a lot of infection. So it's a nice opportunity to do that. And so with periodontal disease, we can measure the microbes, we can measure, reassess, measure, and reassess. We can do this over a long period of time, and I've actually authored a couple papers that are in our professional journals about this process. So one's in Inside Dentistry, you'll have these references, and the second piece is in Dentistry Today, and it's about how periodontal disease and measuring microbes can be used to create predictability in a periodontal disease pattern policy. Here's Joan. She comes into my practice. She's 69. She hasn't seen a physician in a few years. She's diabetic. She has increased adipose tissue. She's a little chubby. She has arthritis, hypertension. She has gastric reflux disease. She has 4 or 5 things that are on the list. Plus, she has very active periodontal disease. And then I do a bug profile, and she has a couple high-risk pathogens, even though they're not significantly elevated, but they're in her system. And she has another bug that's pretty hard to control. So I said to Joan, I think it would be a good idea for you to have a vascular evaluation. So she did. She went down the street to the physician. I ordered advanced lipids just like you had. We happened at this time, we used a Boston Heart Diagnostics report instead of a Cleveland report. Very similar type of testing. Why I want to share this with you for the dentist in the room is look how Boston Heart Lab, by the way, this report's 38 pages long. So if you're worried about giving your patients too much information, Joan read every page of this report. It's a very informative. Your patient base are much more savvy than we think as dentists. We think that people don't understand stuff. I can guarantee you a couple of the consumers in the room will take a lot away from some of this information that we're sharing. It's not too hard to understand. But they break it down into lipids, inflammation, metabolics, and genetics. These key pieces. And if you replace this with bacteria, this is about periodontal disease. It's about the same kind of thing. And so what did they tell Joan? And look at the words they use. Think of it like this. Too much bad cholesterol is like garbage building up in the street, blocking traffic. Your good cholesterol acts like strong garbage collectors and dump trucks that pick up and remove the garbage, bad cholesterol that keeps the streets clear. I mean, how informative is that? How, you know, this is a medical company putting things in language like this for our patients, and that's what we need to do. We need to simplify the language that we use in our patient population. So, and what else do? They personalize the report by putting Joan's name on most of the pages. They actually write Joan's name on the pages, and they say, Joan, you're in danger because you have a high risk of forming a blockage. Why? Her lipids, she has a severe dyslipidemia. So her lipids are totally out of whack, so she has a lot of building blocks of atheroma. What else does Joan have? She has a very high inflammatory panel. That puts her at significant elevated risk. And look what the company wrote. This is this paragraph right here blown up. It says, if you have a blockage in your artery wall lining, you're at high risk of it breaking and forming a clot. If your inflammation is not addressed, you have an increased near-term risk, 1 to 6 months, of a heart attack or a stroke. And let me tell you, if you're a dentist that identifies this in your patient population, they think differently about what you do for them. And it's really significant to help identify these issues for patients. And it's really getting very possible for us to do this. And so we do this all the time for patients.
I am Frank Alexander. I'm a practicing dentist in Arlington, Texas. When I heard David at the Chicago Midwinter meeting this year talking about nutrition and health, got me very interested. He said he was going to have a health summit in Orlando this year. I wanted to sign up just so I could find out more about my health and carry on from what I learned in Chicago. I really wasn't aware before this weekend that 50% of the people have heart attacks or strokes and never have symptoms beforehand. If you're thinking about the future and coming to a summit, I would recommend it highly. I realize it's going to cost you some money, but it is your life. It could affect the longevity of how long you practice. It could affect the quality of life later in your life, and I can't really think of a reason why you shouldn't come.
I appreciate those comments from Frank. You know, we've been getting some questions during the program, so let's answer some of those. Again, email your questions to david@davidminds.com. Here's one. It says, what if my physician doesn't know about this protocol? Well, you know, the truth is they probably won't. We can direct them to where they can learn everything they need to know. But frankly, most of the medical system today is designed for treatment, not prevention. The current reimbursement insurance system is not set up to prevent a heart attack or stroke. They don't pay for prevention. They do pay for treatment. Most medical professionals today are very good at treating sick people. If you have a heart attack and you make it to the hospital alive, the medical system can probably save your life. And the insurance companies will be glad to pay them $100,000, $200,000 to help them do that. In all due respect, today most physicians will give you a statin for your cholesterol and maybe a blood pressure medicine and call that prevention. The problem is most people never take those preventive steps until they have chest pain or even worse. That's not prevention. That's treatment. What we'll do for you is connect you to the network of physicians around the country who do know this protocol and practice it on a day-to-day basis. Now, there may not be one just down the street from you, but we'll put you in touch with someone who can give you continuity of care after you leave the summit. Let's see. Number 2. Here's another one. So insurance does not cover the cost of the summit, is that correct? Yes, that's right. However, since you are attending an educational conference and receiving continuing education credits, this event is tax deductible as an educational expense. You not only are receiving information you can use in your professional life, but it has an additional benefit of being personally applicable as well. It also happens to be held in Orlando, Florida, the #1 tourist destination in America. So you may want to make a little vacation out of it as well. Do we do the blood and genetic testing at the event? Actually, we'll put you in touch with a local phlebotomist in your own area so that your samples can be processed ahead of time. We want you to have all of your results when you arrive at the Healthy Dentist Summit. For those of you that have not had a CIMT done, we will have a technician at the event to test you. All the cost of this testing is included in your tuition. Here's another one. How do we receive CE credit for this? Well, I'll send you a certificate of attendance after you complete the weekend. You'll receive 10 continuing education credits accepted by the Academy of General Dentistry. And here's a good one. Is attendance limited only to dentists? Actually, anyone interested in decreasing the risk of heart attack and stroke is welcome to attend. Many dental professionals bring their spouses with them. Gentlemen, remember, cardiovascular disease kills more women than it does men. We've had members of the general public attending in the past as well. The program is specifically designed for dentists. It's designed to help them improve their personal health and also show them how to integrate total patient care into their own professional practice. But even that information would be a benefit to a non-dental professional who is attending. So yes, you can certainly bring a non-dentist to the summit. Well, thanks for those questions, and if we didn't get to your question on the air today, I'll get back to you after the program. So let's now review. Here's what you get when you attend the Healthy Dentist Summit. We're going to begin with the CIMT test. We need to find out what your current status is. Do you have an arterial age that's older than your chronological age? Is there plaque present in those arteries? That's where we need to begin. By the way, for those of you that have already had a CIMT test at one of my events, we'll take off what you've already invested in the test from your tuition for the weekend. We want you to bring your results with you, though, to the event. Then you're also going to receive a comprehensive genetic profile that you saw Dr. Brewer discussing in his video segment. Of course, we'll do the traditional lipid panel, but you'll also receive tests like the ApoA1, the ApoB, the LP(a), and an inflammation panel as well. You'll do the oral DNA test as well that you saw Dr. Thompson discussing. This is a great tool to integrate into your dental practice, but for now, we want to know where you stand with your personal oral bacterial status. The ApoE genetic test will give us some specific guidelines on how you can best use your lifestyle to decrease your risk. It tells us just how much benefit you can get from things like exercise and alcohol consumption and diet. Not everyone gets the same benefit. Hopefully, you turn out to be an ApoE2 or ApoE3. Those are the better ones. You'll also receive information from Dr. Janice Derrickson on how to integrate this new approach into your life. She'll help you set up a practical strategy that will actually work for you. And we'll have a few surprise faculty members or two joining us this year. Dan Romance will share some bonus material on how actually you can improve your physical health. The majority of the time we'll be talking about your physical health, but Dan will show you how you can actually save money so you can really enjoy those extra bonus years you'll be getting now that you're not ever going to have a heart attack or stroke. By the way, I know that's an awfully bold statement, but it's true. You can absolutely control this disease. You don't ever have to have a heart attack or stroke. We'll show you how to do that. As most of you know, my specialty area is human nutrition. And of course, that's what I'll be discussing during my presentations at the summit. What you may not know is that in spite of having access to the greatest variety of healthy foods in the world, many Americans still fall short when it comes to their nutritional status. So another measure we'll take on you involves the Spectra cell test. This relatively new technology looks at the nutritional status as measured in your white blood cells. This is far more accurate and predictive than the traditional serum blood tests for your nutritional status. Carrie Simon will be creating a customized vitamin and supplement plan that shows your true deficiencies and what to do about them. Diets low in vitamins and minerals have been shown to contribute to arthritis, Alzheimer's, cardiovascular disease, and diabetes. Surveys show that many people who use supplements are not targeting their true deficiencies. How about you? Do you take supplements? Do you know if they are the ones that you actually need? Now you'll know. You'll also receive my complete learning library to take home with you, all my books, CDs, and video programs. And most importantly, you'll receive personalized one-on-one attention from our faculty and staff throughout the weekend. Not only do you get your personalized test results, you'll know what to do with that information once you receive it. And I'm going to feed you really well too. I want you to see that food that is good for you can actually taste great. I want you to understand that you don't have to eat salads the rest of your life to be healthy. So I'm having our meals catered by a local chef so you can see how delicious healthy food really can be. You'll like it. You can learn a lot more specific details about what you'll be receiving at the Healthy Dentist Summit by going to the event website, thehealthydentistsummit.com. If you haven't already, spend a few minutes there, download the special report, watch the video, and sign up. Because we want people to have some one-on-one personalized attention, we're limiting the number of attendees to no more than 25 people. Even though the event is still a ways away, I want to give you an incentive to go ahead and reserve your place now. When you go to the registration page, you'll find a window that says coupon code. If you'll email me at david@davidminds.com, I'll give you the current coupon code, which will save you a significant amount. So before you check out on the registration page, be sure to email me so I can send you the discount code. Now, this is just for those that have joined us on the webinar. The code does have a time limit, and I'll indicate that to you when we email it back as well. So I've shared with you today a lot of features that you receive when you attend the Healthy Dentist Summit. But the real benefit of attending is the peace of mind of knowing that you will not become another statistic. It's the peace of mind of knowing that you won't lose those 17 years of life that the average heart attack takes away from its victims. It's the peace of mind of knowing you are proactively doing the absolute best possible to prevent the big killer of dental professionals. And that absolute best goes far beyond what you can get in your doctor's office or hospital today. This new protocol will become the standard of care in the future. But remember, it often takes over a full decade for research to get down to the day-to-day physician's practice. Many of us don't have a decade to wait. We need this information now. Only several hundred physicians in the United States have been trained in this new protocol. You will have some of the very best experts at your disposal during the Healthy Dentist Summit in Orlando. So email me now at david@davidminds.com and I'll send you the discount code for those of you who joined us here on the webinar. So get that and then go ahead and complete the registration at thehealthydentistsummit.com. Remember, so you can get some one-on-one time, we're limiting the summit to no more than 25 people. Once you register, my office will be in contact with you to go over the details. Whew, well, that's it for today. I know I gave you a lot of information. I hope you find it valuable and you realize how important it is that you do something before you have any symptoms. We can help you with that. Thanks for joining us. I hope to see you in Orlando at the Healthy Dentist Summit.